she'd fire me. That's fine, the New York Times would beg to hire me. Till then I'd log alone. Blah, 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 blah.
And what is really the impact of your legislation? If you're only covering 16 million of the uninsured, then you're barely cutting into the true number of the uninsured, what some like to say, or almost at 50 million. I'd be happy to say 50 million. If they're only going to cover 16, why are we spending $1.6 trillion? So I think they're in a real pickle right now on how they're going to balance the cost plus actually making significant impact in the coverage side. And I think that's why you see this kind of long process drawing out time and time again.
We need to remember there are a lot of other terrible ideas in this. The employer mandate, which is estimated will kill about 1.6 million jobs in the first 5 years at the time we're in recession. An individual mandate. You can't have an individual mandate without a host of other regulations. Because if you have an individual mandate, you have to define what insurance meets that mandate. That means the government has to dictate the benefits. If they start dictating the benefits, the special interests start driving up the price of insurance. And then you have to have price controls on the insurance to prevent that, and the whole thing slides down into this government-run system. The use of the comparative effectiveness and cost-effectiveness research to start dictating standards of care within the healthcare system. The insurance regulations that are going to drive up the cost of insurance for young and healthy people and drive people out of the market, which is why you have to have the mandate to force them back into the market because the regulations made it so bad. All of these things are equally bad, and I'm very concerned there's a lot of weak-kneed Republicans out there who are looking for a compromise, simply in the name of compromise.
If you're concerned about competition, if you're concerned about oligopoly in health insurance markets, why have the government enter the market? Since when is that the solution for insufficient competition? You know, the government was prosecuting Microsoft because it had too much market power. At the time, no one suggested, and if anyone suggested, they would have been laughed at for suggesting that the government should go into the software business and create browsers and that sort of thing. So the answer to insufficient competition is not to have the government compete.
Could you please describe for us the regulatory federalism approach that you mentioned on your website and explain how feasible that option is?
Well, we think there needs to be more competition both in the insurance industry and among healthcare providers. One of the best ways to do that is to allow people to purchase goods and services across state lines, interstate commerce. So, for example, we're suggesting that people who live in, say, New Jersey, which has one of the highest rates of for health insurance in the nation, should be able to buy health insurance if they can find a cheaper policy in Delaware or Pennsylvania. That should be legal. Today, it's not. Similarly, we also believe that people who have medical licenses in Delaware and Pennsylvania should be able to practice medicine in Pennsylvania. You know, the Mayo Clinic, which President Obama keeps talking about, doctors there can practice, say, telemedicine in Berlin, but they can't practice it in Bismarck because the licensing laws there prevent them from practicing medicine out of state. So we think that basically what you want to do is create more interstate commerce and more competition.